Yate, good morning. Vice President Myron Lizer here on this very important live town hall where we have, of course, our own president, Jonathan Nez, but also Dr. Anthony Fauci and Dr. Jim and Dr. Laura Hammitt. We will be discussing some very vital, important news. But first, as we always do, we open up with invocation, a moment of prayer. So if you would indulge me, let's go right to it, and then I will short remarks, and then also introduce our Jonathan Nez, President of the Navajo Nation. So thank you. Dear God, God, we give you praise this morning for another day of life. We thank you, Lord, that we can be about the important topics such as this vital day, Lord, where we talk about COVID-19 vaccine trials, phase 3, Lord Father. But you know all things, Lord. You are our great physician. Lord, we also ask for wisdom, Lord, in which to go forth as leadership makes hard decisions, tough decisions, Lord. But Father, at this time, it's all about options, Lord. It's about you. It's about everything that we are, Lord, as your creation. Father, we give you preeminence this morning. In Jesus' name I pray. Amen. And so as Vice President, we do have this extreme opportunity this morning before us, this Monday, September 21st, to be talking about important vaccine trials for COVID-19. And what a blessing, just to be talking about, to be in the discussion, right, to be a forerunner all across the United States and the world. So I'm looking forward to learning more as the Vice President and as a leader of the Navajo Nation. We also are just thankful for this opportunity. And so, Mr. President, I'm really looking forward to what we're going to be hearing this morning, and we look forward to unveiling this opportunity again, an option. Much over the past, Indian country has not had many options, and here we are on the cusp of potentially a cure for this COVID-19 pandemic and this virus that many are learning more every day, every hour. We're learning more about COVID-19 and how to fight it, how to attack it, how to isolate it and all that. And so this is way beyond my pay scale right now talking about such a tremendous opportunity. So thank you, Mr. President. We look forward to learning more. We appreciate you and your leadership during this COVID-19 pandemic. We've learned a lot from our health professionals, and we help give them a voice by taking this to the tribal leaders and the world. So thank you, Mr. President. Ladies and gentlemen, Mr. Jonathan Nez. Go.
On KTNN, it is live streamed for everyone out there. Aden Daisonof Tsagi, Kon KTNN, Konsha. Shada Diazi do Shikero Shina or Head and Hidi Nido left out of the Nebikaya Pakada Danihinatigi do Daisonof Tsagi Jukodo Shin Ya Dr. Anthony Fauci a Kon Zel in Skagi Shin Atechlenly Washington a Kodo Hanet. Nihiche kuyila. Ado hadainos nido kon hi chinton hize bikitas tito lelta no kodos sad nihiche kudayila jo benda ni tiendo kon nihike ni hidnab jashane dele. Dr. Anthony Fauci ya kon bena nishif inigi jo kodo zel in no kodo ashane nan tinigin hiç koyillam aro yedi golçi ya da kendişni ya akonda le Washington National Institute for Health agenda nishigi CDC do agenda nishigi jo sad hiç kodayilla aro nihe kodo beda hiç aşçane değil ne haday nasne da değil no kalawash yilla betkada kis ado ahanden da so nan tinigi jo zel ene binantin eşi binachiko zel ene dan lenigi nihika ijeo dinas negi de kosenskagi na states ata yakoni. You know, I was saying in Navajo that Many of the public health professionals have helped guide the Navajo Nation throughout this pandemic, and we appreciate professionals like Dr. Anthony Fauci of the NIH, CDC, for forwarding these recommendations for us to use as our weapons. As you know, COVID-19 is a monster that has snuck into our homes, our communities, and our nation. And it's no secret that we were hit hard by this virus, this monster. But you know what, ladies and gentlemen, my Navajo people, I commend each and every one of you for the hard work that you have done at adhering to public health professionals and leaders. And I wish other leaders would do the same throughout this country. What we did here on the Navajo Nation is we took it a little further by incorporating these recommendations into policy and law. In early April, we mandated everybody to wear masks that are here on the Navajo Nation. You couldn't go anywhere. You couldn't go into public places, private places without a mask. And we also mandated the stay-at-home order, the shelter in place. And we went a little further, maybe one of the most strictest public health emergency orders in the country, to where we lock down our nation. We are a sovereign nation. We have the ability to govern ourselves. And we didn't take that lightly to protect our Navajo citizens. And ladies and gentlemen, because of each and every one of you, we were able to bring those numbers, COVID positive case numbers, down to its all-time low. And as you all know, last week, we had 1 day, 24-hour day without one single COVID positive case. And these numbers continue to fluctuate. Because there is no vaccine, there is no cure for COVID-19, and we want you all to continue to use the armor, the weapons that have been given to us to fight off this monster. The weapons and the armor that we have are these masks that we utilize on a daily basis. And I want to, before I introduce Dr. Fauci, I just want Dr. Fauci to know that there are Navajo listeners listening today on the radio and also on Facebook Live today. And I'll just quickly translate the information to the Navajo language. So, Kodo'eya Bahoshnagi Andadi Nakahashni Chikeroshna Junheni Hinachikon di the Kosenskaginas Yakon Nislota. Ado kon Hashchin Hikadan Linigi Bananishidich Inigi Nahandich Kagi Bahehnitzen. Din lay Washington that di Chostoitini Dinas Kagi Dech Ka Ado Kodo Diche Niche hat Zigi a Yego Bananishila. Din lay Ashladin Hahozojan at Ani Lajet Dan has Tanigi Yelanan Nishigila Hastra. Presidents dan linigi hota ya ikaed wado nachen ya kon nikina nish de indo na tan dan linigi da isao da shikeroshina. So konso she so the neck etchen hicha hasito there. So ladies and gentlemen, I'd like to introduce our special guest, Dr. Anthony Fauci. Was appointed director of the National Institute of Allergy, Infectious Disease in 1984. He oversees an extensive portfolio of basic and applied research to prevent, diagnose, and treat established infectious disease such as HIV, AIDS, respiratory infections, and many other, including COVID-19, Ebola, Zika. Dr. Fauci has advised 6 presidents on domestic and global health issues. And Dr. Anthony Fauci, we appreciate you accepting our invitation to speak at our town hall meeting, and the great Navajo Nation and our membership will be listening to you this day. And we just ask everyone on the Facebook Live also to respect and be positive on some of these comments, and I'm sure there are questions as well. So, Dr. Fauci, take it away. Thank you so much. Kat.
Thank you very much, Mr. Nez. I appreciate the opportunity to address you and to hopefully answer any questions you might have. I might just make a couple of comments and not necessarily take too much time, because I want to give the opportunity for some open discussion. So you reported it very accurately that the Navajo Nation was hit particularly hard by this terrible virus and this outbreak. And you had a very high peak in response. But the other thing that you said correctly, and I will back you up on that, is that you rose to the occasion and you responded in a way, despite the difficulties of the experience that you were having, to bring down the level of new cases to a very, very low level. And you did that by abiding the things that I have been speaking about to the rest of the country almost on a daily basis: wearing a mask uniformly, avoiding close contact, avoiding crowds, trying to do things outdoors versus indoors. The reason you should be proud of what you've accomplished is that you have proven that when you do these public health measures, you can turn around a serious surge of infection. And I believe if the rest of the country looks at the model that the Navajo Nation has shown, that you can turn things around by carefully and assiduously adhering to the guidelines of avoiding infection, that we may see this happen throughout the country. This becomes particularly important because we are entering the fall and the winter season, when the ability to physically separate outdoors becomes much, much more difficult. So we want to get the baseline of the country down as low as we see the baseline in the Navajo Nation. So I'm sorry that you went through such a terrible ordeal, but I'm glad that we can use you as a model of what happens when you do it correctly. I have a number of, comments and bits of information about therapies, about vaccines, and about a number of other aspects of interventions that we can look forward to in the next several months to a year. But rather than didactically present that to you, I would be happy to answer the questions that relate to therapy, the questions that relate to vaccines, the questions that relate to the relationship between influenza and influenza vaccines, and as we get into the fall and the winter season. So let me pause there and see if you would like to ask me some of these questions, and I'd be happy to answer them if I possibly can. Thank you.
Well, thank you, Dr. Fauci. I'll ask a question, and then Vice President will follow up after you answer that question. I also wanted to mention to you and the professionals that are listening throughout the country the importance of testing. Now, here on the Navajo Nation, we are close to testing 50% of our total population. And per capita, I believe that that is the highest testing percentage in the country, and maybe in other countries throughout the world. And so we made it a priority to test as many of our Navajo citizens as we can. Of course, there'll be times when you're going to have to test again as we gradually reopen. We are still closed and to our visitors. And as we look to the future, Dr. Fauci, I just want to ask you the importance of testing and what the future of testing looks like as we move forward without a vaccine. Dr. Fauci?
Right. Thank you for that important question. So, just so that the listeners appreciate, there are multiple types of testing. If you want to specifically know whether an individual is infected with a high degree of sensitivity and specificity, the tests that are used are the typical amplification PCR tests, where you take a swab from the nose or the nasopharynx and you put it into a particular vehicle, and it takes usually, depending upon the testing facility that's available to you, it could take anywhere from 24 to 48 or more hours to get the result, but it's highly sensitive and specific. The other types of tests are those that can be scaled up with high throughput. And those are ones that are better for surveillance than they are to specifically know, for example, if a particular person is infected, such as someone who came into close contact with an infected person, and you are doing what you call contact tracing. And that is something that is, I think, very important, because the rest of the country will soon be getting tests that can be done in a high throughput way, so that what you can do, as you said, President Nez, you said that you've tested 50% of the people and you may have to test again. You should have a plan of doing intermittent surveillance of representative people. You may not necessarily need to do 50% of the population all the time. When you get these surveillance tests, you can do them frequency on representative segments of your population. That would give you a good idea if there's any penetrance in the population in a subclinical community level. So I would recommend to you, and I will check this out myself, that when these rapid, relatively inexpensive 10 to 15 minute antigen surveillance tests can be used, you don't require any machinery, any special kind of equipment. You can just do it in what we call point of care. So we should be thinking about that. And when you talk about future surveillance testing, I think this would be something that would be very beneficial to the Navajo Nation.
Vice President, question?
Yes, sir. I appreciate that. Good morning, Dr. Fauci. It's an honor to be have you here on our town hall here on Facebook. Question I have, which is largely a dominating question here on the Navajo Nation from our people. The vaccines are being made very quickly. What reassurances do we have that they will be safe? Thank you, sir.
Well, thank you for the question, Mr. Vice President. It's an entirely relevant question that is, as you said, is being widely asked. So here are the assurances. Well, first of all, one of the reasons that triggers the question of safety is how quickly we have gone from an identification of the virus in January to going into a phase 1 trial, literally within a period of a couple of months, and then to go into a phase 3 trial. I understand that the Navajo Nation has been working with Pfizer for their product, which is a messenger RNA product, but you also have some interest in possibly interacting with other companies that might make a vaccine available. One of the assurances that you are dealing with something that is safe is that each vaccine that is tested has what's called a data and safety monitoring board, such that when data come in, they get to this data and safety board, which is an independent group that looks at the data to determine at what point, if ever, you can say that the vaccine is effective, but also whenever there's an adverse event that could possibly be related to the vaccine, the Data and Safety Monitoring Board sees that and has the power, as it were, to put a pause in the study. This was shown to work the way it should work with another vaccine, one that is being tested in Great Britain, in the UK. It's a vaccine that is different than the Pfizer vaccine and different than the Moderna vaccine, but an individual had a serious adverse event, and the trial was put on hold until it could be further investigated. This is not uncommon when you're testing thousands of people in a vaccine trial. But the reason I think it's a manifestation of why the system is working is that it was able to pick up and recognize this adverse event and pause the trial. The other reason is that before a vaccine is approved, the FDA will carefully scrutinize the data and make a determination if, in fact, it's safe and effective enough to be able to given to the population. They also have advisory committees that weigh into that. So we should feel confident that since these things are transparent, that when a vaccine is ready in the sense of proven safety and efficacy, that it will not be released to the American public before that time.
Thank you, Dr. Fauci. Here on the Navajo Nation, we monitor communities in the states around us. As you may know, 27,000 square miles is the Navajo Nation, and we are in 3 states, New Mexico, Arizona, and Utah. And of those states, only 1 state's mandate people wearing masks. Arizona and Utah do not mandate their people to wear masks. And so we've seen, as you may heard, the state of Utah has seen a big spike, their own records being broken of cases within their state. As schools begin to reopen, we have seen spikes because of that. So there are people, teachers and parents concerned about that. And also the public health professionals saying to us that there may be a second wave during the winter, and that the flu and COVID-19 could be a deadly combination for our citizens throughout the country, throughout the world. The question I have for you, Dr. Fauci, without any vaccine right now, what would be the recommendation from NIH, CDC, healthcare professionals on the gradual reopening of schools and how to prevent a spread within these schools? And I think many of our parents are wanting to know some of those answers in terms of school reopening. Dr. Fauci?
Okay. So, President Nez, so I want to make sure that I understand the question. When you say the schools, are you talking about in these states in general or only within the confines of the Navajo Nation?
Well, sir, we have Navajo students that do attend off Navajo Nation schools. Buses do come on to our nation and take them off our nation to go to school. So it's really a blend of state schools and Navajo schools. As we've always said, what affects schools off the nation does affect our nation and vice versa.
Yes. Well, President Nez, that is a good question because it complicates issues. Because if you have children going out into an area that isn't as stringently trying to control infection as you are doing within the confines of the Navajo Nation, then there's the danger of bringing infection back in despite your attempts if the rest of the community outside of the Navajo Nation does not. So let me just put down some fundamental principles. First of all, with regard to entering the flu season in the fall and the winter, we should try as best as we can to get as many people vaccinated with the flu shot as we possibly can. And the general recommendations of the CDC are to recommend that anyone 6 months of age or older gets vaccinated for flu so that you can prevent confluence of potentially 2 respiratory-borne illnesses, because we know that the coronavirus, SARS coronavirus 2, is not going to disappear. And as we go indoors, it likely will challenge us for a surge. So that's regarding influenza. I might make a comment, Mr. President, about influenza and what you in the Navajo Nation are doing by mandating masks and trying to keep the kind of physical distance and avoiding crowds that got you to the low baseline that you are at right now. And that is that in the Southern Hemisphere, in Australia, Argentina, and South Africa, whose flu season is from April to the end of August, they have found that because they have adhered to public health measures to prevent COVID-19, they have actually prevented influenza to the point that they have had the lowest level of influenza in their memory. So that's a good lesson in the positive sense that if we get vaccinated and we superimpose upon that the public health measures that you are enacting successfully, that you may get influenza off the table in the sense of having to deal with 2 confluent outbreaks. Now, to your question of schools. Obviously, we all want to get the children back to school. That should be a default position, to get them back to school as best as you can in an in-person, person-to-person way. But as we have mentioned, and this has to do a bit, as you said, with Utah and the spillover back and forth with children from the Navajo Nation going back and forth to Utah, to the state schools in Utah, is that what we recommend is that if you are in a green zone, that you can very likely get the children back to school in person in a way that would unlikely result in infection of children, so long as you have a plan of when a child gets infected, how you're able to identify them with testing and segregate them from possibly spreading it to others, particularly if you have multi-generational households in the Navajo Nation, which I assume there are, which means that if you have grandparents or older parents or people with underlying conditions, we've got to be careful that we don't spread it in that way. If you are in a yellow or a red zone, Mr. President, then you have to make modifications of getting the children back to school, either a hybrid of virtual together with in-person to have possible physical separation, wearing of masks and things like that. And if you are in a red zone, then I think you need to really carefully consider whether it's prudent to bring the children back to school until you get the level of community spread low enough that you won't have the inevitable danger of getting all the children infected. It's a little bit of a longer answer that I wanted to give you, but it's a very, very important question.
Thank you, Dr. Fauci, for that. It's very important to continue to, I guess, understand the real reasons for all of your considerations, and you're the expert here. Another question here, sir. When will the vaccine be available for select groups, or will it be just? Let me rephrase that. When will vaccine be available for select groups versus the general public?
Okay. So that, Mr. Vice President, is an excellent question, but it is going to really be totally dependent upon when a vaccine is shown to be safe and effective. Remember, all of the vaccines that are being tested, whether it's the Moderna, the Pfizer, the AstraZeneca, the Johnson & Johnson, Janssen, the Novavax, all of those that are in trial, some of them already far advanced phase 3 trial, we don't know when they will be shown to be safe and effective. My projection had been likely by November and December, but it is conceivable that they might be available towards the end of October. Now, the one thing you need to appreciate is that the United States federal government, in order to make vaccines available as soon as possible after they've shown to be safe and effective, have pre-purchased and pre-ordered hundreds of millions of doses so that by April, they likely will have available in a vial ready to be vaccinated about 700 million doses, which means if you have a vaccine that requires 2 doses, a prime and a boost, that's enough for the entire 325 or so million people in the United States. But directly to your question, Mr. Vice President, what happens is that if the vaccine is shown to be safe and effective, let's say in November, already in December and into January and February, there will be vaccine to vaccinate tens of millions of people in the priority groups. And the priority groups first are the healthcare providers, namely individuals who are putting themselves at high risk. And then there are those who are high risk of getting serious consequences, the elderly and those with underlying conditions. And then after that, the next group and the next group. So those types of determinations have been recommended by the National Academy of Medicine. The final determination would be made by the Centers for Disease Control and Prevention. And I would think that working with the Indian Health Service, that because of the susceptibility to the complications that we've already seen with the Navajo Nation, and I don't want to speak definitively because I don't know the answer to this, but we could find that out about when it would be available to most of the citizens of the Navajo Nation.
Thank you, Dr. Fauci. We're going to transition into an update on the Navajo Nation's COVID-19 clinical trials initiative. As Navajo people may know, we do have a Navajo Nation Human Research Review Board, which is our institutional review board, who gave an approval to the Johns Hopkins Center for American Indian Health to offer for those individuals that wanted to be a part of these clinical trials. I think we all recognize that it's important to see the trials focus on the diversity of our population in the United States of America. In that case, Native American people, because not every vaccine works for various nationalities or body type, as we come to find out. And we've also had, we don't question now, Dr. Fauci, when we get vaccinated for measles, mumps, and rubella. I know it's not the same type of virus, but it is a deadly virus, these MMR. But there have been clinical trials to get that vaccine, and today we get those vaccines, including the flu shots. And as we transition to testing and finding cure, unquote, or a vaccine for COVID-19, it is important, I think, for everyone to recognize that as a sovereign nation, that we have the ability to allow our citizens, those that want to participate for the overall good of our people, to be participants in these clinical trials. So we do have Dr. Laura Hammitt, who is the director of infectious disease prevention programs at the Johns Hopkins Center for American Indian Health, who is joining us on that partnership to give you a quick overview of the clinical trials here on the Navajo Nation. Dr. Hammitt?
Thank you, President Nez. Yate Bene, She'e Laura Hammitt, Yinashe. Thank you to President Nez, Vice President Weiser, and to Dr. Fauci for the comments and for the opportunity to participate in today's very important town hall meeting. As Dr. Fauci mentioned, there are many trials ongoing in the United States right now to try and identify a safe and effective COVID-19 vaccine. These trials have enrolled tens of thousands of Americans, but unfortunately, Native Americans have effectively been denied the opportunity to participate in these clinical trials because almost all of the study sites are in large urban areas that have not done effective outreach to Native Americans. In addition, several companies have opted not to include sites in Indian country because of the time that it takes for cultural adaptation of materials and the tribal approval process. And what that means is that we'll have little data to understand if vaccines will work as well in Navajo populations as they do in other populations to prevent this disease. Tribal communities obviously need to be cautious about research given past research abuses. And the decision is, as President Nez said, the decision to try to offer this study on Navajo Nation came with the input from community members, from healthcare providers, and from people at the COVID-19 Health Command Operations Center. I think as I've been going around Navajo Nation involved in the public health response, and if others have as well, we know that this disease has affected almost every family. And vaccines offer one way out of this pandemic. Ultimately, the decision to approve the study to go forward on Navajo Nation was made by the Navajo Nation Human Research Review Board, who has the responsibility to carefully review all submitted research proposals to ensure that they will offer benefit or potential benefit, that they have a reassuring safety profile, and that the studies will be conducted ethically. Over history, vaccines have been one of the most powerful tools that we've had to reduce health disparities and to improve the lives of Navajo families. Johns Hopkins has had the honor to partner with Navajo Nation, with IHS, and with 638 facilities for more than 30 years to reduce infectious disease, and has conducted numerous phase 3 clinical trials of various vaccines, including the Hib vaccine that protects against Haemophilus influenza type B, one of the leading causes of meningitis, the Prevnar vaccine, which prevents pneumonia, and the rotavirus vaccine, which prevents infectious diarrhea that can be very severe in infants. These studies have proven efficacious, these vaccines, and now these vaccines are used in the first year of life for not only all babies on Navajo Nation, but around the country and around the world. And the data from those clinical trials still actually informs vaccine policy for Native Americans today. The participation in these studies is voluntary and does follow an informed consent process, as President said. The Pfizer clinical trial that the Navajo Nation Human Research Review Board approved has enrolled over 25,000 people in the United States already, and over 30,000 people around the world. The data that we have so far show that it stimulates the body to make a very strong immune response, and that the side effects are similar to other vaccines, meaning that people will have may have temporary redness, soreness, or swelling at the injection site. They may have fever, fatigue, headache, or muscle or joint pain that resolves over the course of a few days. Participants in the study are very closely monitored for safety. As Dr. Fauci said, there's a data safety monitoring board that meets very regularly to review the safety data, and there are strict rules in place to monitor safety. And this is the process by which all vaccines are assessed and approved. Because of COVID-19 and the amount of death and disease that we've seen from COVID-19 and the real need to prevent disease and help get people back to their more normal lives, this vaccine development process is moving more quickly than ever before. The FDA does have processes in place that all of the safety steps are followed, as Dr. Fauci said. And I think it's important to recognize that these are scientists who are not political appointees. They're people who've really dedicated their careers to ensuring that the vaccines are properly evaluated before being licensed for use for the United States. For this clinical trial, for the Pfizer COVID-19 clinical trial, we're inviting participation from adults who are healthy or have stable underlying medical conditions. People who've had a past diagnosis of COVID-19 disease or are pregnant or breastfeeding are not able to join the study. People who are interested will meet with study staff to go through an informed consent process. This is a really important part of being in a clinical trial. Sometimes takes a long time, but we really have to go through the study details to make sure that people understand what's involved, the risks and the benefits, and the fact that it's voluntary, and have their questions answered. Following that, people will meet with a physician to have an interview and a physical exam to determine if they're eligible. People who consent and are eligible will be vaccinated either with a dose of the study vaccine or a dose of placebo, which is saline and does not have any active ingredients. Half of people in the study will get the study vaccine and half will get the placebo. And neither the participant nor the study team, with the exception of the person who administers the dose, knows which group somebody's been assigned to. It's decided by random chance, like flipping a coin. Participants in the study will then get another dose of either the vaccine or the placebo 3 weeks later. And in total, they'll have 6 visits over the course of a 2-year period, where we'll follow the antibody responses by collecting a blood specimen to measure how well the person's responded and if their body's been stimulated to make antibodies against the coronavirus. Participants are also monitored throughout the duration of the study the United States, as we all are expecting should happen hopefully within the course of the next many months. And if a vaccine is to become available during the course of the trial, participants in the trial can find out which group they were in so that they can receive the recommended vaccine if needed, if they were in the placebo group. There are many different vaccines that are in development, as was mentioned earlier, and they all work in different ways. Even the vaccines that we have now, if you think about the hepatitis vaccine or the flu vaccine or the MMR vaccine, they all work in slightly different ways to instruct the body to make the germ fighters or the antibodies to fight the coronavirus. Some may work better than others for certain groups of people. And so there may be benefit to including Navajo Nation and other Native American populations in additional clinical trials. I'm optimistic that the Pfizer mRNA vaccine will be beneficial, but studies must be done to determine if that's the case. And allowing opportunities for Native Americans to be included in these trials will help us to understand that the vaccines that are licensed for all Americans will work to protect the first Americans. If people are interested in joining the study, more information is available at the Center for American Indian Health website, which is caih.jhu.edu. Thank you.
Thank you, Dr. Hammitt. And we're going to transition into, because of time, to our state-like Department of Health. We have a Navajo Department of Health who has an executive director, and that executive director is Dr. Jill Jim, and she will do an introduction, and she does have some questions as well, Dr. Fauci. Turn the time over to Dr. Jill Jim, Department of Health.
Well, good morning, Dr. Fauci and President Nez and Vice President, as we are embarking on a very important, community information and awareness to the Navajo public, to the American citizens, as many outside the Navajo Nation are probably listening to a lot of the forecasting that you are doing. And I've been very thankful and been participating and abiding by a lot of your recommendations for the last couple of months. And we were impacted early on in March. We saw our case on March 17th in our first community out in Chilton-Boothville. And I just want to ensure you that we'll continue to abide by public health professionals and the medical society here in the United States going forward. But I just want to ask a very simple question and see in what ways have you learned anything new about the Navajo Nation that you didn't know about before in regards to combating the disease? Thank you.
Well, I think that I could say very clearly that, as I mentioned to President Nez earlier on, the fact that you could successfully implement a proper, prudent public health endeavor and get your test positivity and cases down to a very low baseline. I mean, I did not fully appreciate how well you had done. And as I mentioned to the president, I think this can serve almost as a model to so many other locations outside of the Navajo Nation, that when you adhere to the public health measures that we've been talking about, you get your case positivity down very effectively. I'm looking at the numbers right now in front of me. You've been very successful. And as we mentioned a little bit ago, this is extremely important as we enter into the fall and winter season, which becomes more challenging as most people will then do their activities indoor.
Well, thank you for that response, Dr. Fauci. And I think as a general reminder to everyone, I think I always appreciate the message that you give to the American public, but also I want to just have you summarize what you said very simply again to our Navajo listeners today and our relatives here about why it's important to understand that the basic preventive measures are very effective, and we have to continue that. So that would just close my questions for this morning, but thank you very much again.
My pleasure.
Thank you, Dr. Jim. Thank you, Dr. Fauci. We are coming towards the end of our town hall. I know that you are a very busy individuals, as we are as well, guiding our nation and also supporting our public health professionals. And we have done the same here on the Navajo Nation. And our prayers go out to you and the many others that are supporting you in finding, if you want to call it a cure for this virus that has come into our nation. And you will hear here on the Navajo Nation, we perceive this as a monster. And we utilized our way of life teaching here, Dr. Fauci, in combating this monster. Our hero twins, the stories of our way of life since time immemorial came in and fought these monsters that plagued our nation. They were hunger, old age, poverty, lice. And then as we moved into modern day life here, new monsters or modern day monsters, alcoholism, drug addiction, depression, diabetes, cardiovascular disease that put us in that vulnerable population, our citizens put in that vulnerable population category. And so the new monster that has snuck into our homes and our community is COVID-19. And I think by utilizing our way of life teaching, Dr. Fauci, we have managed to push this monster at bay. But there may be a second battle coming up, which may be in the winter. But our encouragement to our citizens out there is to continue to wear your mask, social distance, wash your hands with soap and water, and stay home as much as you can. And our young people have really stepped up to protect our elders because our elderly are in that most vulnerable population. So I commend our Navajo youth out there protecting our elderlies because our elderly are holding our way of life teaching, our culture and our tradition and our language. You know, it's sad to say that over 500 of these deaths that happen here on the Navajo Nation, over 60% of those who have died from this virus are 60 years and over. But we continue to utilize our way of life teaching as a message to fight off this virus. And I think that is key as well as in helping us manage this virus here on the Navajo Nation. So I appreciate you, Dr. Fauci, and the work that you have done and you're doing right now. And I'll give you some time for your concluding remarks, sir, Dr. Fauci.
Well, thank you very much, President Nez. First of all, I really appreciate you giving me the opportunity to participate in your town hall. As I said early on, you have done things extraordinarily well. And when I go out and try and plead with the rest of the nation, I will actually bring up the example of the success of what the Navajo Nation has been able to do. I was also very impressed and want to congratulate Dr. Laura Hammitt for getting involved in a vaccine trial to answer the questions that, so many shy away from. We have the same difficulty getting enrollment in other minority populations, African Americans, Latinx, and then others, including Native Americans, Alaskan Natives, and Pacific Islanders. So the fact that you're able to do a scientifically sound, ethically sound vaccine trial in this demographic group is really very important. So I wish you luck, and hopefully we'll, get the information we need to be able to say to the people of the Navajo Nation that the vaccine that will be available will in fact be safe and effective in you, because we've proven in a vaccine trial that it is safe and effective. So thank you again, Mr. President. I appreciate this opportunity.
Thank you, Dr. Fauci, and thank you to your team that are on the call, and Dr. Hammitt, Dr. Jill Jim, Vice President. I know that this is a touchy subject, and we are cognizant of that. And as you see at the stateroom, everybody's wearing masks because they're doing the presentations all in one room. I'm here at home and wanted to let everybody know that we can't let up. Hadainosne, chikeidosne ade daisonosagi. Quichin kodo yezedon hichi because tio tada kata di no a con beyel to aro yedego so yadas to di ne. Nihilla kala washvetada kis ado di ahaganden da so trahat no ako. Sashido da istad. Akon de amado je che masan nala no tlenegi nihin hasula. Chikeidoshin. Je eshi bin na che kon di nasnegi de kosentragi na hast ets a da yakon ni lot at the nebki ka. Sashi yo hashkeje yathiegi be yadashke. Tahot an hi da ha. Ebni na nihina tani do zel endan lenegi kon salada. Kut da silt do beken sits. Dan antine yado alkeje yajikita da no da sad yeje kodalia. To kodo Dr. Anthony Fauci yeje ha zi jo ze ba den akonde ze ba do leo ze do ni da no jo at bayat he konsa hi keni hina do tadan ze do halongo go Dishi mask ya chudel on khadedi khato le shikenasin. Ado dido ze nash dido kosentra nash nigido doshi nache connect do le. Ze do bahalongo. Jukon ya zel endan lengin ik kha. Ze that's halon do le. Jha no what abnanish edel. Jukodo di kon Dr. Fauci hijaha zegi deshka. Dr. Hammitt do deshka hoda. Ebini na ya kodon hikeni hinavij ashton atado shif. Bayadash higi tabdi non hijaha zidi. Dr. Fauci in Washington the ad large tildain the ispa hayaji National Institute of Health will CDC jado yidigo dalina shota. So oban sada kesto le do also adado silta di nida. Conscienza ni keni hin nashdo ka de shwaltansa. Beninagi jo alan hi keni hin na kon adajitten the kosentragin hast aids at da benina. Dishin ashnegi do nache connecta dole. Ebini non dish kash kiroshina. Aro kodo yikeni navja haditze tadi no hut baho atdiche. Nakhatso da dolzenegi edo hela. Judi kon zel indan lenegi shido batso dolzen. Jukadet ya don lego an hidani znon de krida benina judi nashnegi. Akonde haje ze bahalanda dole winzinshi ara ben nache elkhil del neshdole do hande itle dole kadet do hande itle ilbeda hazan la na da nitsen sunat ani jlingo hot wug with the naban to the kisla nakha nitsen odi nekodoshna Vice President Myron Liza ko yuhannen hijakulya akonde jadi ya ababi raho baho agiben nache Dr. Fauci hijaha zigo lesh kidoshna so hadainosne bichidi ka Aro kedo hajonda hadotle oyol kijil kitasitli hashi binina. Yamasan hicheni nala kodon hijandat ze. Oyodo kedenil inda dasitli. Akonche kodo the neck echiya del tiegido here all in and the nas kodalle egijot abenda no hinchikero shina. Ba he nit ben hitzilo nas de nika. Shikero shina. Ban so kes. Do at dol kata di nida dido dinas negi ze bahalonigi do atsko. Din dol kata di nida. La shi lana danza. Shide kodo atraka de shwaldanza nigi baat. So nicht jado nicht in das de lot eshikedo shuna. Yike nicht in la da jitten. Aro nicht yike nicht in do la de hospital dol na ota. La nicht jashone de la eko dolato. Betskil dali di de kosigi da no. Yajashanen deidla. Ebony nan ha nitsano da di nishikero shina. Egot abin nach machin nache. Hanagin gich ekol yado lefliche. Aro here la da isnoftsagi. Dodan hinnatlagi. Consoshin hich hasito lefti ya Jonathan Nez, Navajo Nation president. And then hich konade yado leftoshinada vice president. You know, it takes some time to do some translation in the Navajo language. So some of our people, and I probably didn't do much justice because this is medical terms, and some of these terms have yet to be translated into the Navajo language. And so I ask for your forgiveness because I am not a doctor, but there are doctors that are on the team. And we'll definitely give you an update in the Navajo language tomorrow during our town hall meeting, or Thursday evening during our KTNN Live town hall. And again, Dr. Fauci, thank you so much for spending your morning with the Navajo people and giving us some insight on what's happening here in the United States globally, and what is being done to fight this monster, and also what the future holds for the citizens here in this most powerful country of ours, the United States of America. Our continued prayers for you and your team, and we look forward to possibly other town hall meetings in the future. And we do welcome you here, Dr. Fauci, to the great Navajo Nation when time permits. Thank you so much.
Thank you. Thank you, Mr. President. Thank you for having me. I really appreciate it. And good luck. And thank you, Laura. Good to see you.
All right. So this will conclude our town hall meeting. God bless you. Continue to wear your masks, social distance, wash your hands with soap and water, and stay home as much as you can. God bless you, and God bless our great Navajo Nation. Have a good day.